Hello, I'm Dr. Maury Markmer from City of Hope, and I'm going to be completing this three-part series on precision cancer medicine, past, present, and future, with focusing a little bit on the future. Now, the future in this area is an evolution. It doesn't all of a sudden start. We're beginning to see today some of what I'm going to describe over the next few minutes. But one of the really important developments as relates to the future will be the idea of routine, standard of care, molecular monitoring of cancer. And of course, that implies in the blood. We have, obviously we look at tissue. We can even look at a liquid tumor biopsy, so-called liquid tumor biopsies for cancers at the beginning to define therapy. But the idea that we could potentially monthly take a tube of blood and routinely monitor the course of the disease in terms of progression, yes, but more important than that in terms of therapy but find an abnormality in that assay that can predict a future drug that will be effective. We're obviously beginning to do this in lung cancer, where we find particular mutations that are present that said, okay, now this EGFR mutation, which we had originally seen, has now mutated in terms of a large percentage of the tumor to a different mutation. We have another drug that might be effective, but the idea that we can routinely monitor, and this also implies being able to do it at a cost that is in the hundreds of dollars, potentially, not in the thousands of dollars, if we're certainly talking about monthly monitoring, every other month monitoring. We are not there yet, but hopefully we will be there in the future with many tumor types. So it's one thing to say we are going to monitor progression of the disease. And of course, one can argue very appropriately that if the therapy isn't working, you shouldn't be giving the drug, both because of side effects and cost. But from a patient's perspective and from the doctor's perspective, what you want to be able to find is not just that the disease is progressing and the drug isn't working, but what might we employ now that we actually know or have a high probability of might be effective. So it's this documenting quickly, or as quickly as possible, before, for example, the disease progresses in a major way with large masses, symptoms, etc., that the biology of the cancer has changed. We won't necessarily know how it's going to change, but we'll find it, and we will hopefully have a platform of drugs. Obviously, I'm now talking about the future. 4 or 5 or 6, 7, 10 different drugs based upon the molecular platforms, the molecular abnormalities that we've seen as these tumors change. Document that and switch the therapies. Cancer is increasingly in advanced stages becoming more chronic in nature. Obviously, I'm talking about a situation where we have to be concerned about toxicity. We certainly have to be concerned about cost, but assuming we can deal with these issues, the idea of monitoring in a cost-effective way the status of an illness, modifying therapy to allow a patient to continue with an excellent quality of life as defined by the patient through this type of a strategy is a very reasonable perspective or hope or plan for the future. When will that occur? Well, it's obviously going to evolve over a period of time. And one would anticipate that certain disease types will evolve quicker than others. On the other hand, we may actually see a number of drugs that are going to be relevant across, as I mentioned last time, the tumor agnostic platforms. We might be able to see with a particular abnormality, this is a relevant drug for multiple tumor types if we see this pattern. Again, all that to be determined through research over the coming years. This is a very exciting, very provocative, very complex time. But from the perspective of the potentially helping our patients live lives of excellent quality from their perspective, this is a very reasonable hope and plan for the future. And I thank you for your attention.